Groff, your president of the Downtown Topeka Rotary Club this year. Please join me in the first verse of America. First off, along with you. Thank you.
The sweet land of liberty, happy I sing. Land where my fathers died, land of the pilgrim's pride, from every mountain side, let freedom ring.
And now I'd like to welcome, please be seated. Now I'd like to welcome Grace Morrison to the podium this morning. She is going to, actually, this early afternoon, she is going to do the Rotary Minute, guest introductions, and our Rotary Toast. Grace.
Thank you, Mark. We have a number of guests today. We're very glad that you're here. First of all, Kelly Trout, who is a guest of Brent Trout. Kelly has been here several times, and we have a family application in. So, hi, Kelly.
Hi, Kelly.
Our next guest is Melody Burns. Melody is with AmeriCorps Vista, a nonprofit, and she is a former Rotarian from Colorado. And we're glad you're here. Hi, Melody. And our next guest is Tracy Glover, a guest of Wayne Penn Post. Tracy works with the Boy Scouts, and she is the Assistant Scout Executive. Hi, Tracy. We're glad you're here. And we have several visiting Rotarians as well. First of all, Jason Fitson from the North Topeka Rotary Club. Hi, Jason. Guest Kathleen Hine. Someone who hardly needs an introduction. Roger Underwood, who's a guest of Joni and a member of Topeka South. Hi, Roger. And finally, Lisa Prost, again from the North Topeka Rotary Club. So, hi, Lisa. We're glad you're all here. So let's give them a round of applause. I have the honor today of giving you a little Rotary Minute, and I'll try to keep it from a minute to a minute. We all are members of Rotary International, and what I'd like to do is focus on the actual international portion of this. Most of you know that several of us went to Guatemala a month or so ago, and I'd like to share with you a very brief bit about what the international piece means. And you're going to get have a full program on our Guatemala trip on November 8th. But these are just a few of the highlights. First of all, I would like to highlight the difference that we made through this hands-on international trip. We provided fresh, clean paint to a very rudimentary medical clinic that was already there. And we also provided and built 2 exam rooms, and I'm talking rudimentary. These folks had, for pain medicine, they had 2 ibuprofen pills left. So they were very grateful for the 2 little bottles of ibuprofen. And I might say also that this clinic did not even exist 5 years ago, and it's there only because of Rotary. We also provided fresh water to these folks. We assembled 50 very rudimentary filter systems, but they're very, very effective, and now we know that they last as much as 25 years. These went to 50 different households, which served literally hundreds of people, going from filthy water, which we saw with our own eyes, kind of a nice brown color, to a very clean, bacteria-free water. We also provided basic school supplies to the school, which went through 6th grade. And some of these supplies included pencils and pens and crayons, and our club, with the money that was donated, provided basketballs and soccer balls, which they did not have. We also were blessed to be able to share goodwill and peace. We were a presence in these very small and extremely poor communities, and they knew, because of our Rotary shirts and because of the time that had already been spent there by other Rotarians, that they could trust us. And with the government situation, they could not trust other people coming in. We had great appreciation from them. We received these adorable little bracelets, these hand-woven bracelets. that the children had made. And I will tell you that there wasn't a dry eye in the place when they tied those on our wrists. And finally, among many other things, we developed friendship among Rotarians, not just the Rotarians in our club, but also Topeka South and others. And also we had the honor of visiting 2 clubs in Guatemala. The first one was called the Rotary Club del Valle de Guatemala, which was in Guatemala City, and they put out the gold tablecloths for us and everything. Very, very impressive. And then the second one we visited was actually an E-Club. So the president came to sit and have a cup of coffee with us, Guatemalan coffee, I might add. And all the rest of the folks are elsewhere, even in other countries. And with that, I would like to present these 2 flags yes, thank you, from these 2 clubs that we visited. The first is the Club Rotario del Valle de Guatemala, and the other is Cyber Club Rotario Lake Atitlan. So I'd like to present these 2 flags to President Mark, and also we will raise our glasses in a toast to these 2 clubs. Hear, hear. Thank you.
Thank you, Grace. Couple of quick announcements. Our featured charity this month is Grace Med. Their mission is to show and share the love of Jesus Christ by providing compassionate, accessible, high-quality care for residents in the communities we serve. Some other announcements. August 16th is National Roller Coaster Day. Speaking of roller coasters, our jokes today are about first love and getting shot down. Love is like a roller coaster. You rise, then fall. You rise again, then fall, then you puke. If you didn't like that one, how about the famous rejection line? Sorry, but I don't want to go out. I'm not tall enough to ride your emotional roller coaster. And now Larry Dimmitt's going to come up with a fun announcement that will appeal to all of you with a competitive streak.
Thank you, President Mark. I have an announcement to make today, and I'm sorry that the individual who was going to be here couldn't be here, because it has to do with issuing a challenge to our club to compete with another club to see which club can have the most new members this Rotary year. And I want to read you a note that I received from Carl Chinnery. Some of you may know Carl. He's a lawyer, and he's from Lee Summit, Missouri. And here's what he says. Larry, sorry, but I cannot make it on Thursday the 16th. I wanted to make the challenge personally because I am so concerned about the shortcomings of your club in so many ways. He said, the Lee Summit Club will win this challenge hands down with our hands tied behind our backs. So that gives you a little feel for what we're talking about here. Yes?
I had the fortune of sitting by him as we were flying back from Toronto.
Was that an experience?
Yes. Fortunately, Roger was closer to the but
anyway.
They have been storing up
okay.
memberships.
Carl,
they are ready.
Carl is going to be our speaker actually on December the 6th, so you'll get to see him in person then. But anyway, the contest is this. Lee Summit is over across the state line, and they are a club of about 153. And they have challenged a number of clubs in the area, including the downtown Kansas City Club, to a membership contest. And Carl says they won all but one. And so the nature of the contest is that we will measure the number of new members that our club attracts and the number of new members that their club attracts, and compare those numbers. And the one that comes up short, so to speak, will have to pay $200 to the Rotary Foundation. So, not that that's a bad thing to do, but it's just an honor thing. So, you'll hear a lot more about this, but the challenge is on, and the Lee Summit Club, they have 153, we have about 185, and I am totally confident that we can whip their you-know-whats and show them how it's done. So, that's more
Thank you, Larry. And now Brad Hopper, if you'd approach the podium and assume the push-up position. I'm just kidding, the push-ups, but while he's coming up, we do have district team training this Saturday. If you haven't heard, it's free. Thank you. Somebody was listening. It is free. It's in Lawrence, and it'll be great. There are a lot of people up there. Brad, we'd like to present you your red badge, and we look forward to helping you turn it into a blue badge as you become engaged in the important work of Rotary at your club. Rotary Club, it is a great pleasure to welcome you as the newest member of our club. We look forward to the fellowship that we will share, as well as your participation in many club projects that make our community, country, and world a better place in which to live. Fellow Rotarians, please rise and welcome our newest member with you.
Yeah.
Yes. And now Stan Teeter will introduce our speaker. Thank you.
Thank you, Mark. Just as a little aside, we have two members here from the North Peter Rotary Club, and as you know, I helped in the starting of that club many years ago, and they're struggling a little bit, and so any good ideas you have in helping them get their membership built up, please pass it on to Jason and Lisa. Our speaker today is Dona, Booe. She is currently president and CEO of the Kansas Children Service League. The league is a recognized state charter of Prevent Child Abuse America and a serves statewide private nonprofit company operating in Kansas since 1893. I've been involved with the Native Owners Group of the founding though. Dona's experience in human services began in 1984 with the Kansas Department of Social and Rehabilitation Services. She provided leadership in the development of home and community-based service programs for both adults and children. In 1987, Dona served as the Medicaid Policy Director for SRS. In 1999, Dona returned her attention to focus on the field work of SRS, accepting a position as the Chief of Social Services at the Topeka Area Office, overseeing all of child welfare services for Shawnee County. And under her leadership, Shawnee County recognized a 25% reduction in the number of children entering foster care while maintaining and improving the safety of children in the community. After having served as SRS Northwest Regional Director from 03 to 06, Dona accepted the position as Vice President of Program Services for the Kansas Children's Service League, successfully leading KCSL out of the role as one of the state's child welfare contractors. Under Dona's leadership, KCSL focused and prioritized all efforts on evidence-based programs, models that prevent children and families from entering the child welfare system and helping children within the system find safe, stable, and supportive families for a better future. As a personal aside, I have been amazed to learn of the great costs we as a community and businesses endure because of adverse child events. Though through KCSL, Kansas is a leader nationally in programs to prevent adverse child events. As business leaders, we all need to encourage and support these efforts, so I hope you'll listen very closely. Lifelong Kansas, Dona grew up in Humboldt, who graduated from Emporia State University with bachelor's degrees in business administration and industrial psychology. She married Larry Booe in 1980, and they have resided in Topeka since 1987. Please welcome Dona as our speaker.
Well, good afternoon, everyone. It's nice to be here today and see some of our trustees in the audience from KCSL and some of our friends who've worked with us in advocacy, and I always thank Stan for his support and his leadership. It means a great deal to us. Before I get started, I do want to thank Grace for sharing her comments about the devastating situation for children in Guatemala. We're a statewide organization. In some of our early childhood programs in Southwest Kansas, we have children from Guatemala that we serve in our Head Start and Early Head Start programs. And I can tell you, from probably all of us in this room, the conditions that they're living in, we would see as very poverty-stricken in Southwest Kansas. But from where they come from, they will tell you they have never been so grateful as for a chance to thrive in the United States of America working in the beef packing industry. Those children are beautiful, and as you said, their families love them dearly. We had a group of mothers from Guatemala who hand embroidered beautiful little art class aprons for the kids that just, as you said, brought tears to your eyes to see the efforts they go to build a better life for their children and their families in this country. So for all of you Rotarians, thank you for the work you do, not just in Kansas, especially in Topeka, but around the world. It does make a difference, so thank you. I'm going to talk to you a little bit today, and thanks to Joni for her invitation and bringing us here this afternoon, a little bit about how adversity in childhood is impacting all of us as taxpayers, as business leaders in our community, and what a difference that makes to our worker productivity and as well the safety and well-being of children. So to get us started today, we are celebrating our 125th year of services in Kansas, and no, Stan really wasn't one of the founding members, but probably some days it feels like that to him, that he is. Our mission is to protect and to promote the well-being of children. Very briefly, we have always been involved with the bringing into care children who find themselves orphaned or abandoned. That was our earliest work. It was very much volunteer driven. We still have a lot of volunteers involved in our work, to the tune of about $250,000 a year is the value of our volunteer services these days. I always like to say we were the first to get government funding for our work. It was in 1921 when Governor Tapper would come over to the receiving home in Topeka that was right across the street from the Capitol and give each of the kids a dime. So we were the first. So if you want to know who to blame, that's where it all started. Between 1920 and 1960, we focused our work on advocacy, raising awareness of the plight of children who've been abused and neglected. We worked on public policy at a federal, state, and local level on what is best practice and what is the right thing to do for kids and families. And then in 1993, we became the first nationally recognized state chapter of Prevent Child Abuse America. We are a private, not-for-profit 501c3, as Stan said. We're statewide. We work between Kansas City and Liberal and have a strong presence in Southeast Kansas as well. This needs a little bit of updating. We have 250 employees, full-time employees, that reach 40,000 children. In Kansas, we have an $18.5 million budget in the current year, and as the Kansas chapter for Prevent Child Abuse America, we're interested in all types of abuse and neglect that happen to children. The things that you all can conjure up images of in your mind, whether that's physical abuse, sexual abuse, neglect of all forms that come from parents who are not adequately prepared to care for a child. Those can be from a caregiver, from a parent, from a peer, anyone who is in a position of power over that child. So just a little bit of data from Shawnee County for you right now. There were, in state fiscal year that ended in June 30th of this year, 5,475 reports of child abuse and neglect just in Shawnee County. That's about 10% of the state's total number of calls to the Department of Children and Families. 3,000, a little over 3,000 of those reports were actually screened in for an investigation by a social worker and sometimes in partnership with law enforcement. That's, if you think about it, about 10 every business day. Every business day, there are 10 families being investigated related to concerns of abuse and neglect. And approximately 11% of those are substantiated as child abuse and neglect. Almost one almost one for every one of the reports. So overall, Kansas has experienced about a 20% increase in the number of calls coming in with concerns of abuse and neglect in the state. You can ask yourself, why does it happen? Why are children being abused and neglected? And we'll talk about this throughout my presentation. But basically, in our field of work, we call them risk factors. Kids are born into this world without instructions. If some of you got instructions when your kids were born, let me know. We'll talk. But parents are not always prepared. They don't have the skills and the experience to raise a child successfully. They may not even have the emotional capacity to be a good mom and dad. Perhaps it was because of their own models of parenting that they experienced. Perhaps it is because of a mental illness, substance abuse, and neglect, a lot of bad choices perhaps that have been made. But nonetheless, there are a lot of children born into Kansas without the benefit of parents who know how to raise them, and a lot of parents who don't have a healthy support system around them. I would also guess that in this room, when you brought your children home from the hospital, that you may not have known everything to expect when you were raising that infant, but I would also wager that you had a healthy support system around you. Someone you could call if you had a question. Someone that would come over if you were exhausted and tired. Someone that you could trust with the most difficult time of your life, and you would know that they would give you good advice. So many of the families that are in trouble in terms of parenting, they have no one to call that they can trust. If they called a parent, a sister, a friend, or a neighbor, the situation they're in would probably spiral further out of control rather than to get better. So these risk factors are the cause of child abuse and neglect, and it's simple. When the risk factors outweigh a family's protective factors, which we'll talk about a little bit, child maltreatment occurs. And in Kansas, we have an interesting way of addressing child maltreatment. I love this chart in the inverted pyramid. If you see at the bottom of this, there are all kinds of prevention efforts that are available, evidence-based programs, research that shows we can mitigate adversity in childhood through service interventions. We know whether they're universal, whether all of us in this room could benefit from them, or whether they need to be targeted to the highest risk. But that's not what we do in this country. We wait, we wait, we wait until the phones ring at the Department for Children and Family Services, and a child is being abused and neglected. And then we provide services. We get the courts involved, we get attorneys involved, we get the judge involved. We make an already complicated situation very stressful, more complex, more difficult to maneuver through. And that system at this point in time in Kansas is at an all-time high for the number of families being served in the foster care system. And if you think about it as a high acuity level of care, not unlike nursing facilities, not unlike the ICUs in our hospitals, not unlike state mental hospitals, foster care is the highest acuity level of care when children and families are in trouble, and we're overwhelming it. And I would wager that any of our high acuity systems of care, medical or otherwise, would sometimes fail us if we were bringing everyone into that system of care and not doing any kind of preventive treatment first. So, what's happened? Well, there's been a couple of major studies nationally. The first one is the Adverse Childhood Experience Study. You have a handout on your table that speaks to this a little bit, about the 5 things you should know about ACEs. And then there was a second study that was done by the National Scientific Council around the brain architecture of a child who is growing up and developing. All of which link to rethinking how we look at child maltreatment or child abuse and neglect. We have, since the inception of best practice, looked at it as a social welfare issue. I worked for many years in social and rehabilitation services, and I would have told you it's where it belongs. I'm not convinced of that anymore. Because of the magnitude of the problem, which I'll show you in a minute from the research that has been completed, it affects nearly 1 out of 5 of every adult in this country. So we'll talk about that some more. It is contributing to significant health burdens in this country, and there are remedies. There are ways to mitigate the effect of adversity in childhood. Call them immunizations, if you will, but there are ways to prevent the disease from growing. And so I would argue and offer up that we ought to stop thinking about it as social welfare, something that happens to those people in other zip codes, in other parts of the state, and start thinking about it as a public health concern. So the ACE study itself was a collective effort of Kaiser Permanente, Harvard University, and the Center for Disease Control. And they worked on this for years and years, and those of us in the field were kept saying, publish your results, and they waited, and they waited. And finally, about 6-7 years ago, they came forward publicly with the results of the ACE research. It was the largest study of its kind. It included 17,000 participants. And what they did was Kaiser Permanente, as an HMO, took one of their healthy, normal adult populations. The average age was 57 years of age. They were college educated, living in upper socioeconomic classes, all working, apparently a healthy research project. And what they found was that 20% of those individuals involved in this adverse childhood experience study, 20% were at a danger level in terms of how adversity during their first 18 years of life was impacting their health outcome as an adult. And so they asked this question on a very simple surveying questionnaire, asking people things about what was your life like as a child? Did you experience physical abuse? Did you have one of your parents gone most of the time? There was a variety of questions that they asked, probably 10 to 12, but from that, these ACE scores were developed. So it has a lifetime influence. And I want you to think about this a little bit. If you struggle as a child, if you're experiencing adversity, being raised by a parent with substance abuse problems, being raised by a parent who is experiencing domestic violence, if you are being raised by a parent who's living in extreme poverty and has no support system to manage through those crises, your adversity is going to lead to a flaw in how your brain gets developed. The actual brain architecture changes. And I hope there are doctors in this room who go, Dona, please stop. Because I am making a muck of that. But in my terms, that makes sense. So the social, emotional, and cognitive impairments that children suffer because their brain doesn't have the chance to develop prenatally through age 5 as successfully as some of the rest of us, they enter school completely unprepared and really unable to learn. They're suffering at tremendous rates. Our schools are suffering as a result of this. They can't control behavior. They can't control emotions. They don't have the brain architecture to make that happen. So what happens? They get to grade 3, they're not so darn cute anymore, and they can't read. They're struggling to learn to write, to do even basic math, and they're failing. And what does that feel like when you're 8 or 9 years old, to be a failure? You start making bad choices. You hang out with the wrong kids. Maybe you start smoking way too young, as if there's ever a good time. You maybe start adopting risky behaviors, like when you get your driver's license, you're drinking and driving and partying. All of those poor choices that lead to healthy risk behaviors mean they're probably not going to graduate from high school, and we're seeing those indicators in our country. They're going to have worse health outcomes. If you're drinking and you're pregnant as a teenager, all of those things lead to higher costs in health care, worse outcomes for you as an individual, and ultimately that disease and injury and disability leads to early death. From the study, we know that people who have 3 or more ACEs will die 10 to 15 years sooner than their peer group. That's a tragedy. There's also the numbers, right? We can't study anything like this without understanding what it means, and Stan mentioned this. What these adversities in childhood are costing us economically are not what we're spending for these families on interventions with services or for children in the child welfare system or even the high cost of education. Look at that number. Of the $124 billion childhood adversity is costing us in this country, the greatest economic impact is in lost worker productivity. 70% of the cost is hitting all of us. As CEOs of companies, we have a workforce that's aging 18, coming to apply for jobs, who do not have the skills or the social emotional development to become productive citizens and workers in our economy. We are paying a huge price for failing to immunize families against adversity. If we were to look at the system the way it ought to be developed in the nation, and especially in Kansas, we would spend a lot more of our time and energy on those prevention interventions, finding ways to mitigate and immunize families so that children are not abused and neglected, so that the phone and that top level of involvement in foster care doesn't ring, but about 40% as often as it's ringing today. My estimations in looking at the reasons for children coming into care, more than 60% of the children that are entering foster care are children that we ought to be serving under these universal and targeted strategies in the community, and never bothering government services with that effort. Parents are our answer, and we know that. All of us in this room know that. But how are we, as CEOs of companies, as concerned citizens, lifting up parenting and making it a part of our culture? The protective factors that will mitigate those risk factors that families have, we all have the responsibility there. We should be celebrating parenthood. In Kansas, we have an incredibly strong value, a public policy value, that the right to parent is everyone's right. We also have a very strong value in Kansas that everybody ought to be working really hard. And we believe in that. We grew up believing that. So how do you bridge the value of Kansans to be parents and the value of Kansans to work hard and mitigate childhood adversity? You create family-friendly work environments. You praise parents who are parenting well. You give them opportunities to parent within their work life. You celebrate family. You find low-cost strategies to create supports for working parents rather than making them choose between being a good parent today or coming to work today. How do you find those solutions? And they're not all expensive. They're not all burdens on productivity at the end of the day. We have to think creatively. We have to help parents parent well. And if we do, we can all connect the dots. We will have families with newborns in their home, with toddlers in their home, who know how to parent them, who know how to nurture them, who know how to teach them, who know how to support them. And by the time they're 5 years old and ready to go to school, they're going to be amazing little kids. Classrooms will be more like probably what I experienced in 1973. And where going to school was the best part of your day, and your teachers loved you and adored you. And if there was a child who struggled, there were lots of people to wrap their arms around that child. And if they're doing well in school at age 5, by the time they're in the 3rd grade, they're going to be reading at the 3rd grade level, maybe even beyond that. The classrooms are going to be calmer. Behavioral disorders are going to be at a minimum. And if they're reading at a 3rd grade level, they're not going to adopt as many risky behaviors. They're not going to drop out of high school. They're going to graduate, go on to college, trade school, or enter our places of business ready to contribute. And if that happens, all of us, as citizens of this wonderful country, will grow better and be stronger and be healthier and produce more. So to wrap up, just a little bit more on the cost analysis. In state fiscal year 2018, our community, Shawnee County, had 740 children, our kids, from our neighborhoods, living in foster care. Each one of those children costs $27,000 per year for their foster care placement, plus all of their health care costs, plus all of their education costs. If we would have assessed that family at the time of the child's birth and identified those risk factors that led up to child abuse and neglect, we could have caught that early. We could have immunized that family with what we deliver as one of many home visitation programs in the state at a cost of $6,000 per family, not per child, for the entire family to benefit. And we are 98% successful in preventing child abuse and neglect from ever entering that child's life. And ultimately, the national studies show that for every dollar we will invest as private citizens or as government, for every dollar, we will save 7 on more costly services later. I don't know about you, but from a business management point of view, even from Emporia State, they would have said, good job. So what can you do to help right now? Certainly, if you see something, say something. I would not want any child in our community not to have the opportunity to be helped. If we think or are worried about a neighbor's child, a family member, call and report child abuse to the Department for Children and Family Services. But I would also implore you to think about the work we do at the Kansas Children's Service League to prevent child abuse and neglect. Follow us on Facebook, visit our website, come to our office and to one of our mission tours and learn more about us. Support April Child Abuse Prevention. You can plant a pinwheel garden at your place of business. They're beautiful in April every year around town. So with that, I'll say thank you. Did I live within my time? And there I am, just waiting for you to call me. Any questions? There is a question in the back. Yes, please, go ahead. We are not a child welfare contractor. Kansas Children's Service League does not do case management for foster care. We intersect with the Department for Children and Family Services by recruiting adoptive families. You may have seen Wednesday's Child on WIBW. That is some of our work where we try to find families for children whose parental rights have been terminated and they cannot go back home, but no one has stepped up to adopt them yet. There's about 1,000 children on any given day in Kansas who cannot ever go back home, but do not have anyone who wants to take them in as their parent. So we intersect there with DCF, and as well, we sponsor about 60 foster homes in various counties. And so as a child placing agency, we foster homes. We take care of them so that if DCF places a child in one of those homes, we know that they'll get great care while they're in there. Good question. Yes?
Can you talk about staffing and other resources? Are you adequately resourced to do the type of job that you're attempting to do?
Part of the reason that I put the inverted pyramid up there is because that is exactly, prevention is not funded by government, although in full disclosure and transparency, about 60% of our $18.5 million budget is from federal grants or state grants to work in the area of prevention. The 2 largest are federal funding for Head Start and the TANF block grant in Kansas for our home visitation programs. So prevention is not adequately funded anywhere in the country. Most of the tests say it is funded at about 20% of the need. But I will go on record here, my board and trustees have heard me say this too, and I can't imagine that it feels personal to them, but private funding for prevention work community resources, private foundations and grants are the best resource to do interventions with families that don't feel threatening, that are strengths-based, where you don't have to check a box to make somebody fit into the program, but rather working with each family where they are with evidence-based interventions. So is it adequately funded? No. Do I think there's a way to fund it? Yes. And I hope that this year we will be engaging corporate CEOs in an advocacy agenda and a public policy agenda about how do we help families become great parents in this country.
Dona, thank you so much for that insightful presentation. We have a book plate for you to sign, and if you'll trust us to put that in an appropriate book, we will donate that to Ross Elementary's school library in your honor as our speaker today. We also have a Rotary 4-way coin to give you, and would encourage you to live life that way, and when you meet somebody else who you can encourage to do that, pass it on as well. So thank you again.
Thank you so much. Thank you all.
Before we wrap up, I just wanted to see a show of hands of anybody who made it to the Grace Med ribbon cutting and opening party yesterday. Our team wasn't able to make it. We were out doing outreach, but I personally interact with dozens of people every week who are going to be consumers or already are consumers with their team. And just wanted to say that this year we set a goal as your board to do a better job of communicating all the incredible things you as a Rotary Club and you as individuals in this community are accomplishing and doing. I hope that you leave a little lighter today and that your footsteps are lighter, hearing about the great work that happened in Guatemala, the great work that so many of our members are doing with KCSL, and the great work that Grace Med is doing. They're our cup money this month. And it may seem like $1 here and there, but Mother Teresa once said, it may just seem like one drop in all of the ocean, but if you don't add your drop, the ocean's missing something. So I would encourage you to keep adding your drop, and I hope that you leave a little bit lighter from lunch today. Next week, we'll be meeting back in the Ramada in the Grand Ballroom. Bert DeWeese from Rebound Therapy is going to be talking about office ergonomics. And so if you're short on ibuprofen pills, as the clinic was in Guatemala. A note from Linda says, if you have aches and pains from sitting or standing, don't miss this presentation. The slides are great. That doesn't include any aches and pains in your backside from any of your teams that you manage. With that, let's conclude with the 4-way test. Thank you. Of the things we think, say, or do, is it true? Is there fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And will it be fun? Thank you.